membership and anybody over 50 and over, this is a very important issue to them as healthcare goes through some real complex changes. And what's paramount for AARP is that our members have access to healthcare while all these changes are happening. It's particularly important that our members feel that they want to age in place, they want to be in their community for as long as they can, and having access to quality healthcare is paramount in order for that to happen, particularly in rural areas. What I think is very challenging is that trying to keep these rural hospitals open. If DSH payments are discontinued under the Affordable Care Act, that's a pretty hefty revenue stream for hospitals to remain open, and particularly in rural settings. And if that goes away, what you have then is a problem where that hospital could close and suddenly you don't have access to quality health care in your community. You're now having to go to someplace other than where you want to be, which is in your community. The infrastructure does not only need to be maintained, it needs to change. People are accessing health care differently. There's telemedicine, there's movement towards outpatient care, and some folks don't drive the car anymore, so they need transportation help to make their appointments. And in rural communities, those are some of the things that often don't exist. So it's paramount that you are active in your community, talk to policymakers and influencers in the community, that access to quality health care is important. There are a lot of opportunities to have that hospital there locally. It's also probably one of the biggest employers in the community, big tax base, and again, you have local access to good quality health care from ER to hospice to caregiving. So it makes a community whole to have that kind of access.